Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Nigeria discharges 3,442 COVID-19 patients, including 2,967 community recoveries in the Federal Capital Territory and 103 in Crossroads State. NCDC fully deploys surveillance outbreak response and management system, Sawmas, for real-time tracking of infectious diseases. And Australia's Victoria State reports lowest COVID-19 cases since the month of June. The Nigeria Center for Disease Control, NCDC, has reported more than 3,000 persons who have recovered from the coronavirus across the country. Of the new recoveries, more than 2,000 were recorded in the Federal Capital Territory, the FCT. According to the Center for Disease Control, the 3,442 discharged patients were recorded in 24 hours, include 2,967 community recoveries in the FCT and 103 community recoveries in Crossroads State, managed in line with new case management guidelines. With the latest recoveries, the total number of those discharged now stands at 47,872. The NCDC also reports 126 new cases confirmed in 16 states and the Federal Capital Territory. The nation's capital recorded the highest at 37, followed by Lagos, 27 cases. Plateau recorded 16 cases, Kaduna 9, Abia 7, 6 were recorded in Gombe, another 6 in Ondo, 5 in Imo, while 2 each in Delta, Ekiti, Kwara, Oyo, and states like Bauchi, Kano, Katsina, Ogun, and Yobe recorded 1 cases each. Till date, 56,604 cases have been confirmed. Death toll is at 1,091 across the 36 states and the FCT. Now, the Nigeria Center for Disease Control, NCDC, has announced the complete deployment of Sawmas. It's a digital surveillance tool which facilitates real-time reporting of cases of epidemic-prone diseases, including COVID-19, by health workers across states to priority health facilities in the 774 local government areas in the country. According to the center, this would enable digital disease surveillance. In 2017, the deployment of Sawmas started in 8 states in Nigeria for real-time reporting and analysis to manage outbreaks such as the 2017 monkeypox outbreak, the 2018 meningitis and Lassa fever outbreaks. By digitalizing disease surveillance data, states are able to share information and engage in rapid decision-making. Sawmas means Surveillance Outbreak Response Management and Analysis System, and it's an open-source mobile e-health system that processes disease control and outbreak management procedures in addition to surveillance and also early detection. Now, ahead of National Business and Technical Education Examination, a group, Development Research and Project Center, is providing support to graduating students of Government Girls Science and Technical College, Dapchi, that's in Yobe State, to mitigate the impact of the coronavirus pandemic. Making the presentation, the Executive Director, Judith Ann Walker, represented by Dr. Mustafa Kolo, explains that the project will also go a long way in ensuring the students abducted but released by the insurgents continue with their studies without trauma.
Dapchi community in Yobe State became popular when 105 students of Government Girls Science and Technical College, Dapchi, were abducted by Boko Haram insurgents on February the 19th, 2018. It is therefore cheering news and a dream come true that these 8 students among the 105 students released are now writing their final year examinations. To comply with the COVID-19 safety protocols at exams, DRPC, in collaboration with Open Society Foundation, is offering support to students of GGSTC Dapchi and 2 other technical schools in Yobe State to mitigate the COVID-19 effect.
So this project is specifically focusing at students that are writing NAPTEP exam for the September-October 2020 session.
We are praying that under the able leadership of our present Commissioner of Education, really this very assistant will contribute a lot. We do write 3 type of exam in this very school because of being science and technical. We write WAEC, we write NAPTEP, and we write NECO. And this very assistant is categorically focused towards a NAPTEP. And for this year, we have 162 students that are going to write NAPTEP.
The students who applaud the government for relocating them to the safer area of Government Girls Secondary School Nguru in the state also called on government not to forget their colleague Leah Sharibu, who is still in captivity.
We really want the government to care about our sister Leah Sharibu because she's in captivity.
There is no doubt the graduation of these students will give hope to other students who might have dropped out of school as a result of insecurity in the region.
The Dapchi State Governor, Bala Mohammed, wants more safety measures in correctional facilities across the country. He noted that admitting those awaiting trial has been a challenge in the facilities due to the COVID-19 pandemic, and he wants the National Assembly to make budgetary provisions for the construction of isolation centres for inmates. He said this when the House Committee on Reformatory Institutions paid him a courtesy visit at the Government House, Dapchi.
Our police stations in Dapchi are full to the brim during the pandemic, and because they are in a very serious ambivalence of admitting those awaiting trial before they are tested and cleared for them to join the inmates, considering the congestion inside the prison. And we believe the only statutory body with that responsibility is the correctional services. It would amount to abdication of responsibility for them to reject them. At the same time, they are also treading on the path of caution, because if they bring infected COVID-19 patients into the correctional services, then it will be a disaster. So I'm asking the House of Reps to come up with a budget to establish isolation centers inside the correctional services, so that even after COVID-19, it can be used for that purposes of isolation. Whoever is going in should be tested. Unless it's found to be negative, he or she should not join other members of those inside the correctional services.
The need for reliable data collection and coordination for national planning and development cannot be overemphasized. This was highlighted when the management of the National Identity Management Commission, led by the Delta State Coordinator, Mrs. Henrietta Okolo, paid a courtesy call on the Governor of Delta State at the Government House in Asaba in commemoration of the World Identification Day. With the theme, Identity for Health, Sustainable Development and Growth, the state coordinator says in view of the COVID-19 pandemic, it is apt to ensure the management of palliatives by various governments and donor agencies using the National Identification Number, NIN, urging Nigerians to register and be captured in all government's plans.
In consonance with what is happening in the world now, I'm talking about the COVID-19 pandemic. Nobody saw this coming, but it's a good thing it happened, and God knows why it happened. But it is going to put us in a good stead to prepare, for things and situations like this.
Let's go over to Crossroads State, where the COVID-19 response team has continued its sensitization exercise across the state. The team, led by the Commissioner for Health, Dr. Betta Edu, visited the Cameroonian refugee camp at Abuja for health talk, distribution of face masks, hand sanitizers, and other palliatives. She emphasized that while the refugees remain within the state, it is the duty of the state government to continue to protect them. Well, she joins us now, the Crossroads State Commissioner for Health, Dr. Betta Edu, via Skype. Thank you for joining us on the program. I'd like to begin by asking if you could talk to us about the fears of the Crossroads State government with where it is located and the border area, especially as we are tackling the coronavirus pandemic and how that is driving the sensitization.
Thank you very much, and it's nice to be on with you. I think the COVID-19 pandemic has come to strengthen a lot of the different areas in the health sector, and one of it is the risk communication area. We've been doing a lot of work because of the location of the state. Remember that the state has very, very wide border with Cameroon, and Cameroon has a high number of cases, confirmed cases of COVID-19. For us in Crossroads State, we've identified border areas, we've identified hotspots where we visit from time to time to talk to them about COVID-19 and see how we can provide PPEs for health workers working around those areas, increase surveillance, get in more natives, that's the locals, to be part of the surveillance team, improve the skills and capacity of course, the rapid response team to be able to respond in time when they have suspected cases of COVID-19. And what's most important is the fact that the state has also been able to set up sample collection centers, one in each local government, and then of course sample collection centers in these hotspot areas. One of it was the refugee camp in Abuja, which is where we house over 36,000 Cameroon refugees in Nigeria. And of course, you know, the borders are not so tight. So from time to time, we might have one or two persons coming in from Cameroon into our state. And we're continuing to work with the Immigration Service and several other key stakeholders to see that we don't have people come through. However, those who are in, we'll continue to sensitize them, we'll continue to bring them into the fold to ensure that they are part of the surveillance team that can be able to report when we have suspected cases. Beyond that, we've made available face masks, hand sanitizers, and several other palliatives to support the Cameroonian refugees.
Well, just like some of the visuals we're sharing right now, we're seeing a lot of awareness and sensitization. We also notice there's also a crowd. So in line with the safety protocols, especially with physical distancing, how are you trying to perhaps raise that awareness? Another thing also is testing, regular testing. Is that taking place?
Yes, we have a lot of testing taking place. Really, sensitization is key for us because it would help people come forward voluntarily to get tested. And of course, sensitization is going on, testing is going on, and number of tests done in the state has really increased over time, with over 100% increase. However, the rate of positivity has remained very low. For instance, in a border community in Boki, that's a Abuja border community, we had over 150 samples taken, and we had just one case positive, and that case was said to have just returned from where we traveled to. So we're seeing a situation where we're doubling on the number of samples we're taking and the number of tests that's being done. However, the positivity rate is quite low.
All right, we appreciate your time. Wish you all the best as you continue with the awareness there in Crossroads State. We've been talking to the Crossroads State Commissioner for Health, Dr. Betta Edu. Thank you for joining us. Let's head over to Bayelsa State, where residents seem to have gotten over the fear of contracting COVID-19. Here's our correspondent, Dobrat Timewood. She tells us more.
Most residents of Bayelsa State are no longer seen wearing a face mask at public places. In fact, sensitization programs regarding COVID-19 has greatly reduced in the state. We spoke with the head of Public Health Department in Bayelsa State regarding plans by the Bayelsa State government to ensure that residents are still aware of the danger coronavirus poses. And here's what he said the Ministry of Health is doing regarding the fight to curb the spread of coronavirus in Bayelsa State.
It is correct that there's been a massive reduction in the positivity rate countrywide. If you look at the recent cases, countrywide, we find out that there's been a lot of reduction. But that does not mean we are resting our hands, because we don't want to get to a situation whereby we'll get a second or a third wave. That is one thing that's going to cause a lot more problems. You know, all of those resources we put into this COVID response. We don't want to get another wave. So we're doing all that is possible to ensure that does not happen. And for that not to happen, we need to get enough data to know where we are in terms of the response, which means we still need to be collecting a lot of samples. In fact, I speak with you for us as a state. We do 1,500 samples every week. That's the target the national response are giving to Bayelsa State. And as much as possible, we try to ensure we meet that target. What that will tell us at the end of the day, you know, from week to week, from month to month, is to let us know where there is likely to be where a second wave could likely happen. You know, so if we're getting positivity from a particular area or community, we know that we need to go and do a lot more engagement in those communities or those areas to ensure that there's no spread beyond those communities. So that's what we're doing. So we're trying to close out the response perfectly with data. So, and that data can only be gotten with sample collection and testing. And that's what we're doing.
Out of the 393 confirmed cases for COVID-19 in Bayelsa State, there are only 2 active cases as at today. 370 persons have already been discharged, and the state has recorded 21 deaths. From Yenagua, Dobra Timiwood for COVID-19 updates.
The World Health Organization reports that more than 41,000 health workers in Africa region have been infected with COVID-19, accounting for 3.8% of all reported cases. Frontline health workers are at greater risk of infection because of the care that they provide to patients. The WHO is celebrating today World Patient Safety Day and saying that healthcare workers need to be taken care of to protect the patients. We have joining us from Abuja studio, Mr. Jalili Kilani. He's the Assistant Director, Clinical Pharmacy and Pharmacovigilance Services at National Hospital, Abuja. Thank you for joining us on the program.
Thank you for having me. Good afternoon.
All right. First, I'd like to get your reaction to the number of community recoveries last night the NCDC recorded coming from the FCT. It is good news, isn't it?
Yeah, it's good news because we're happy that at least we can turn about 2,000 more formerly COVID positive patients. They got well, and then they were discharged. So it's a very good one. It shows that the protocols we've been using have been effective, and so it's a very cheering news. And that, but just like we've been saying, it's not yet Uhuru, and people should still be very, very careful so that we do not encourage the spread of this deadly disease.
We've been told to indeed fight community transmission, being that 73% of the cases are passed through that. What role do you think community pharmacists are playing during this pandemic?
The community pharmacists have been playing a very, very good role in curbing the spread of the disease. First of all, one of the roles is making sure that medications are available and at affordable prices. They also engaged in public education of the people regarding the encouraging people to be very, very hygienic, the issue of hand washing, then hand sanitization, in fact, production and making available the very good quality hand sanitizers. And then I find that many of the community pharmacies also ensure that, in fact, enlightenment of the populace is very much going on. Most of them have stickers and handbills that they give to patients and even people that come there. And they also engage even in public enlightenment. So they have been helping the government in curbing the spread of the disease. And some of them also even donate PPEs to government agencies to help in the fight against this deadly disease.
This year, WHO is saying that the health workers' safety is a priority for patient safety. On health worker safety in Nigeria, how would you say we have fared?
Well, we know that the safety of the health worker is very, very much paramount, because if the health worker is safe, then the patient will be safe. So the World Health Organization actually has chosen a very good slogan. The Nigerian health system has tried its best in making sure that the health workers are safe. There was a time that when this COVID-19 became so rampant, and that everybody was panicking, and then the issue of availability and even affordability of PPEs, but they were a challenge. But now most of these challenges have been overcome. So PPEs are made available to the health workers, especially those working in the isolation centers. And not only that, even those working in the normal clinics and then pharmacies. So we now have enough PPEs, and that the health workers are also being trained and retrained on the issue of how to make sure that they engage in proper hand washing, hand sanitization, and making sure that they don their garments effectively, and also they know how to doff. Because if, and part of our training is also that we should not be so much in a hurry to take care of a patient without protecting ourselves first. So that one has been ingrained in us, that in fact, there's nothing like emergency when you have not taken care of your own safety. Because if you are not safe, then your patient will not be safe, and then even the community will not be safe. So we can say that by and large, the government has tried to make sure that the health workers are safe by providing safe PPEs and other gadgets that will make us to function effectively and efficiently.
We appreciate your time on the program, Mr. Jalili Kelani, Assistant Director, Clinical Pharmacy, Pharmacovigilance Services, National Hospital, Abuja. Thank you for joining us. And as a health worker, we salute you today.
Thank you very much.
Australia's Victoria State has reported its lowest COVID-19 cases since the month of June. The state, which is home to 1/4 of Australia's 25 million people, now accounts for about 75% of the country's more than 26,800 COVID-19 cases and 90% of its 832 deaths.
Australia's Victoria State says the daily rise in coronavirus infections has eased further on Thursday as the state began relaxing most restrictions outside its largest city of Melbourne after a steady drop in cases in recent days.
That is an increase of just 28 new cases since my update yesterday. That is the first time that the case numbers have been in the 20s since the 24th of June.
Residents in regional areas of Australia's second most populous state can now have outdoor gatherings of up to 10 people, and cafes will be able to seat up to 50 people outside. Chilean authorities are calling on citizens to celebrate Independence Day on Friday with caution to prevent a new wave of coronavirus cases in the country. In Chile, the Independence Day holiday is followed by the Day of the Glories of the Army and normally see large crowds of people celebrating or heading to the beach or other holiday destinations.
You can take a further look at our website. It's channelstv.com. It has the latest update on the pandemic. All you need to do is log on. There's several other stories there as well. That's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Wonwaka. Stay safe.